everyone. My name is Malia Boone. I am a program manager for the Crisis Stabilization Service at Delaware Guidance Services. They call that program Mobile Response and Stabilization Services. So what we'd like to do now is focus on supportive treatment options. Once we've gotten to the point where we have identified some concerns and we know that a child may need treatment in the community, this is the point where we're at to try to help families figure out the next steps. Families seeking treatment for children who are struggling often feel overwhelmed with this process. They may not be sure where to turn, and they may need guidance when trying to manage this often scary moment in their lives. Families don't have to walk this journey alone. There are many resources in the community, and schools are a really important starting point to helping them access those services that are available in the community. There are many agencies and private practices throughout the state of Delaware who provide outpatient counseling services to children, youth, and their families. And those outpatient counseling services are services where children and their families are going to a building usually, and they're receiving counseling in that location from treatment providers who specialize in areas that will best support your child or their child. Delaware Guidance Services is just one agency that specializes in working with children and families. I'm part of Delaware Guidance, but there are many other agencies out there that families can access. Others can be found through going to the Division of Prevention and Behavioral Health Services website. Under Information for Families, there's a full list of providers that partner with Division of Prevention and Behavioral Health Services. Families can also call 211 and request resources related to the specific concerns they may have, not just outpatient counseling, but also other resources that might be available to them to meet their needs. They can also search on websites like Psychology Today to find providers in your area. For children and youth who might require a little bit more intensive level of service, a referral to Prevention and Behavioral Health Services can also be made. The children could potentially access more community-based levels of service where providers come into the community to work with children and families where they are in schools and in homes. Another service that is available for children and youth is the crisis bed service. And the crisis bed provides short-term stabilization when a child is experiencing a crisis. So the crisis bed program provides support, counseling, and possible medication management as needed while the child is admitted in that program. Families can access a crisis bed through the Mobile Response Crisis Program. Once a risk assessment is completed with that program, a decision can be made about the best course of action to help keep the child safe and stable during that crisis situation. So once the child stabilizes at the crisis bed, which may only be a few days to maybe a week, then the child can return back to their home, back to the community, and continue with treatment with community providers that will continue over the long term to help keep them stable and find the support they need to be feeling better. Another service families may need to access is inpatient hospitalization. This level of service is a bit more intensive than the crisis bed service, but also provides stabilization, medication management, group counseling, and case management to make sure services are in place for continued stabilization once they're back receiving the support they need in the community. Families can take their child directly to an inpatient facility of their choice, or they can also access hospitalization with the support of the Mobile Response Crisis Program following a risk assessment. One other source of support that is available to families is residential treatment. And this is also accessed through connecting with Prevention and Behavioral Health Services or the family's commercial insurance company. This service does require authorization and kind of review to determine whether or not it is the best option for the child and the family. So educators and families can expect this process to take maybe a few weeks or longer as information is collected and that determination is made about whether or not that is the most appropriate service for them to access. Schools, families, and the provider community are integral to supporting the behavioral health needs of children in our state, and working together through clear communication, understanding the resources that are available to connect with and support families through navigating this process will lead to better outcomes for our youth. Families can find resources in a variety of ways. I already mentioned a few, but searching online, also through other peer supports in the community, and also through the education community. So that's why it's so important for our education staff to be on the front lines of awareness of these services that are available. Schools are the trusted, safe place for children and families, and we want to support our educators the best way we can from a community mental health perspective.